guys, welcome to my YouTube channel. And in this session, I would like to tell you about hospital department. Oke, dan hari ini kita akan belajar tentang nama-nama tempat yang ada di rumah sakit ya. Nah, yang pertama kita mulai dengan namanya apa ya kira-kira? And you guess what kind of hospital department are there in the hospital? Let's check first. The first one is accident and emergency or casualty department. This department treats the patient with serious illnesses or injuries, especially life-threatening ones. And the next one is admitting department, atau tempat di mana kita melakukan registrasi, administrasi. Place where the patient will be required to provide personal information and sign consent forms before being taken to the hospital unit or ward. Jadi di sini kita melakukan tantangan persetujuan sebelum pasien dipindahkan. If the individual is critically ill, then this information is usually obtained from a family member. Namun, jika pasien itu mengalami masalah atau sakit yang serius, maka informasi ini didapatkan dari keluarga pasien. The next one is ward, a large hospital room with beds for patients to stay. Nah, ruangan bangsal yang ada di rumah sakit disebut dengan ward. Next, ICU or intensive care unit is a ward where patients who are seriously ill require constant, close monitoring and support from specialist equipment and medication. Next, maternity ward is a place for pregnant women or women who have just given birth. It also provides antenatal care during childbirth and postnatal support. Di ruangan bersalin ya. Next, pharmacy or in common word we can say drugstore or dispensary. It is a place where drugs and medicines are prepared and sold. Or in bahasa we can say apotek. Next, burn center or burn unit are often used for the treatment and recovery of patients with more severe burns. Jadi ini ruang untuk pasien yang mengalami luka bakar. Next, sterile processing department or SPD, a place in hospitals and other healthcare facilities that perform sterilization and other exchange on medical equipment, devices, and consumables. Nah, jadi di rumah sakit, peralatan di rumah sakit, kemudian alat-alatnya semua itu perlu disteril sehingga hygiene-nya tetap terjaga. Maka ada ruangan SPD. Nah, cardiac intensive care unit, a hospital ward specialist in the care of patients with heart attacks, unstable angina, cardiac dysrhythmia, and other cardiac conditions that require continuous monitoring and treatment. Jadi di sini ruangan untuk perawatan yang mengalami masalah dengan jantung seperti itu, masalah dengan kardiaknya. Kemudian outpatient clinic provide medical procedure, tasks, and services to the patients that don't involve an overnight hospital stay. Jadi di sini adalah ruangan atau klinik untuk pasien rawat jalan. Next, operating theater, a facility within a hospital where surgical operations are carried out in an aseptic environment. Ini adalah tempat untuk melakukan operasi. And next, geriatric ward covers and assists with a wide range of issues associated with seniors. Ini ruangan untuk lansia. Next, pediatric ward, department which deal with the care of the children. Jadi ini ruangan untuk anak-anak. Next, ENT department provide comprehensive and specialized care covering medical and surgical conditions related not just specifically to the ear, nose, and throat, but also other areas within the head and neck region. Jadi ini biasanya ruangan untuk mereka yang mengalami masalah dengan THT. Next, X-ray department and radiology department, the facility in the hospital where radiological examinations of patients are carried out using the range of equipment listed, including fluoroscopy, X-rays, CT, ultrasound, MRI, and GI procedure. Jadi di sini kita melakukan CT scan, kemudian X-ray, MRI, seperti itu. Next, discharge lungs. Patients who don't need to stay in a ward are transferred to the lounge on the day of discharge. Many hospitals now have discharge lounge with facilities such as TV, radio, puzzle, magazines, books, and newspaper. Nah, yang tadi kita ada ruangan admitting, di mana biasanya kita diterima, mengisi administrasi, kemudian ada discharge, itu pada saat pemulangan. Jadi pasien biasanya ditransfer di sana. Finance Department, or commonly called cashier, answer all billing questions and contents, requests for itemized bills and accounts balance inquiries. It also assists patients in their insurance benefit for services rendered. Next, Gastroenterology Department. This department investigates and treats digestive and upper and lower gastrointestinal disease. Next, Urology Department, run by consultant urology surgeons and investigates areas linked to kidney and bladder conditions. Jadi di sini masalahnya dengan ginjal, biasanya dirawat di Urology Department. Next, mortuary, it deals with the preservation of the dead body. Nah, di sini biasanya ruang untuk menyimpan mayat, disebut mortuary. Next, Dentistry Department, providing dental care for children, oral and maxillofacial surgery, or even special care dentistry. Jadi ini ruang untuk perawatan gigi. Next, Dermatology Department provides a wide range of services for the diagnosis and care of people with skin diseases, including skin cancer. Ini untuk perawatan kulit. Next, Pathology Department is a department where employees studies and diagnose disease and must wear gloves and goggles. Jadi ini untuk mendiagnosis penyakit, ruangan patologi. Next, Orthopedics Department, place which contends with disease, injuries, and conditions of the musculoskeletal system relating to the body's muscle and skeleton. Jadi ini ruangan yang berhubungan dengan muscle, dengan otot, kaki juga. Nah, semuanya. Jadi pada saat kita di rumah sakit, pasti ada kalanya kita akan menanyakan arah. Di mana sih letak ruangan ini? Kemudian di mana sih letak ruangan itu? So in the hospital, maybe all of you will confused with the direction or where the location of the place. So you will ask someone or somebody to tell you the directions. So what is the function of this expression? So if you want to ask directions, you need to get the clear information. Jadi kita menanyakan arah untuk mendapatkan informasi yang lebih jelas. Nah, here are some phrases and expression for asking direction in English. For example, where is blah blah? Where is the pharmacy? Like that. And then the second one, how do you get to the pharmacy from here? And next, how do I get to dispensary? Can you tell me how to get to blah blah blah? And then can you give me direction to the blah blah blah? What's the best way to get the blah 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 blah? And excuse me, could you tell me how to get to blah blah blah? Excuse me, do you know where the blah blah is? Are we on the right route for blah blah? Is this the right way to blah blah? Okay, this is the same one to ask the direction. Like, could you tell me where blah blah blah? Can I find blah blah? Where is blah blah? So you can use the name of the hospital there, the name of the hospital department, and then I'd like to blah blah. I'm looking for, or how do I get there? Can you direct me to blah blah? Could you tell me the way to, or is this the way to? I would like to go to, and then the 11th one, which way is it to? Or I need direction to get to. Or you can say, please tell me how I can get to blah blah from here. Now, the verse, if you want to get the direction, you can say, go to blah blah, you are telling the listener what way to go to or how far to go. And then the second step, then you are telling the listener what to do when they get there. Maybe they have to turn right or left, go straight, or etc. So if you want to give the direction to someone, you just say, go down, misalnya turun, go up this hall or corridor, silakan naik. Next, go straight or go ahead, silakan lurus. And then turn left, belok kiri, turn right, belok kanan. Go around the corner to your left, jadi pergi ke sekitaran di pojok yang ada di kiri. Go across the hall, jadi go across the hall. Kemudian ada upstairs, oh itu ada di lantai atas. Downstairs, lantai bawah. Next, go down, turun. Take the first left, jadi belok kiri, kebelokan yang pertama. Follow the street, jadi ikuti jalan ini. You will pass bla bla. Kamu akan melewati ruangan apa gitu. Keep going or keep stay on this way. Jadi tetap di jalan ini. And then go straight, lurus. Go to, pergi, turn right, belok kanan, turn left, belok kiri, cross, menyeberang. On your right, di sebelah kanan. On your left, di sebelah kiri. Beside, di samping. Next to, di sebelah. Behind, di belakang. Across from, di seberang. In front of, di depan. At the corner, di pojok. So if you want to give direction, you can say, this that way. Atau this way. Jalan ini. Take this road or take this way. Go down. Silakan turun. Take the first on the left. Jadi, belokan kiri yang pertama. Take the second on the right. Nah, belokan kanan yang kedua. Turn right. Continue straight ahead for about a mile. Jadi lurus aja. Or it will be on your left. Oh, di sebelah kirimu. It will be on your right. Di sebelah kanan. You are going the wrong way. Kamu di jalan yang salah. Or you are going in the wrong direction. Kalau misalnya dia di jalan yang salah. Nah, ini contohnya. This is the map of the hospital department in the hospital. So we have maternity unit, and then toilet, pediatric ward, toilet, nurse station, and then children playground, nurse station, lift, ICU, hospital, nurse station, security, nurse station, and toilet. For example, from here, from the stairs. So if you are now in the stairs, and then you want to find out the postnatal clinic. So you will ask the security, excuse me, can you tell me the direction to postnatal clinic? Oh yes. Okay, so start from the stairs. You go to if you want to go to postnatal clinic, you have to go straight. Then after the nurse stations, then the postnatal clinic is on your left side. You understand? So I hope this information is important for you. Jadi saya harapkan informasi ini penting untuk kalian semua sehingga kalian bisa pelajari lebih lanjut mengenai bagian-bagian yang ada di rumah sakit. Terima kasih sudah menonton channel ini. Semoga ini sangat bermanfaat bagi Anda. Thank you for watching my channel. Bye-bye. Bye-bye. Thank you for watching my channel.